Welcome to the deep dive. Today, we're getting into something, well, fascinating and really relevant to all our health. Network analysis in public health. We're looking at a key review article from back in 2007, Annual Review of Public Health. It really sort of shows us how this approach helps uncover these hidden connections, the ones driving health and disease.
Exactly. And our goal here is to unpack what network analysis really is. It's not just like a fancy chart you see sometimes. It's a powerful way to see the hidden structure, the architecture of health issues. It gives you insights that, honestly, traditional methods often just can't capture. It's a shortcut, really, to understanding those invisible ties.
Okay, right. So let's dig in. What is network analysis? Beyond the buzzword, I mean.
At its heart, it's simply about studying relationships. Think of actors. These could be people, organizations, even health programs. And they're connected by links, which just show some kind of relationship between them. Visually, yeah, you often see it as points and lines, nodes and edges. It's basically graph theory applied.
Graph theory, okay.
Yeah, and what's really cool is how it pulls from so many different fields. You've got mathematics, sociology, biology. They all contribute.
So it's about mapping connections. But how do you actually study that? How does it work in practice?
Well, the approach itself is structural, meaning it focuses on the patterns of ties. It's grounded in actual data, empirical data. It uses mathematical models. And yeah, it's very visual, very graphical. I mean, the core ideas aren't brand new. Think of Leonhard Euler back in the 18th century figuring out that Königsberg bridge puzzle. That was basically the birth of graph theory.
Right, mapping the bridges and land masses.
Exactly. Or even that idea of 6 degrees of separation, the thought that anyone's connected through just a few acquaintances. That came from a Hungarian writer way back in 1929. And then you had people like Jacob Moreno, a psychiatrist in the 30s, developing sociograms to literally draw maps of friendships and relationships. These things laid the groundwork.
Okay, so the foundations are there. But the really interesting part for us is how this gets used in public health. Where has it made a difference?
Oh, it's been huge. A real game changer in, I'd say, 3 main areas: tracking disease transmission, understanding how information spreads, and looking at social and organizational networks. Let's take disease first. Traditional epidemiology might tell you how many people got sick, the frequency. Network analysis shows you the structure underneath that outbreak.
So not just who got sick, but mapping the actual pathways, like connecting the dots between cases.
Precisely. A classic example back in 1984 was a study showing a diagram of 40 early AIDS patients across 10 cities. The links were their sexual contacts. It was really powerful early evidence visually showing how AIDS was spreading.
Wow, okay.
Or remember that syphilis outbreak in the late 90s? Among teens in a wealthy Atlanta suburb, they mapped out a network of nearly 100 teenagers connected by sexual contact. These visuals aren't just interesting. They show how the disease moves through specific relationship pathways. That's actionable insight. And it also highlights how someone's position in that network matters. Are they central, with lots of connections, or more on the edge and isolate? That directly affects their risk for things like HIV. Understanding these roles and even different mixing patterns, like who connects with whom, helps explain why STDs spread differently in different groups. This led to real changes, like the CDC using network approaches for TB contact tracing.
Yeah, and it helped with things like SARS too, right? Modeling those rapid outbreaks.
Absolutely. Predicting and containing spread relies heavily on understanding those connection structures.
Okay, so disease transmission is clear, but you mentioned information spread too.
Yes. Think about how new ideas or health practices get adopted. Rogers' diffusion of innovations theory touches on this. Network analysis shows that who tells you something and the relationship context can matter even more than the message itself.
Interesting.
Yeah, like studies finding that people with more connections, direct or indirect, to family planning information sources were more likely to know about and use contraceptives. The network delivered the info effectively. And then there's the whole area of social support and social capital. These are the resources we get from our social ties. Network analysis helps us quantify and understand this. Consistently, research shows that having larger, denser social networks is linked to better mental health, even lower mortality rates.
So our connections literally keep us healthier.
In many ways, yes. And it applies to organizations, too. You can map how, say, different clinics or health departments work together, or maybe where they fail to connect effectively on a common goal, like diabetes prevention.
So you can spot the bottlenecks.
Yeah.
Or where collaboration could be stronger.
Exactly. It makes the invisible web of connections visible, whether it's friends influencing smoking habits or agencies coordinating a response.
It really shifts the focus, doesn't it, from just looking at individuals to seeing the whole system of relationships.
That's the key takeaway. Network analysis gives us a different frame, a new way to ask and answer really critical health questions. It moves beyond just what are your attributes to what are your connections and how do they shape your health.
It's a completely different lens. So
Yeah.
thinking about all this, what stands out to you? How could really understanding these networks fundamentally change public health? Or even just how you personally see the world around you? Something to think about.